Chair Hart and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding a coronavirus disease 2019 COVID-19 update.
Dr. Del Reynoso, welcome.
Thank you, and good morning. My briefing topics for today include an overview of our local COVID-19 data, a lengthy conversation about the blueprint for a safer economy, as well as updating your board on our efforts around vaccine planning and our local testing capacity. So for the period from November 2nd to November 16th, we went from 9,992 cases to 10,577 cumulative case count. So that is roughly a 6% increase during this time frame. Also during this time frame, we went from 103 active cases to 255 active cases. So that denotes a 148% increase in our active cases. We went from 10 hospitalizations to 13, and we went from 129 to 133 cumulative deaths. That's roughly a 3% increase. Over the past 2 weeks, like the rest of the state and nation, we saw increases throughout our county. We saw, starting with South Coast, Montecito, and Carp, we saw a 2 going to 18 cases. So that's an 800% increase. We saw Santa Barbara going from 24 to 32 cases. Goleta from 1 to 15 cases. South County, north of Goleta, we went from 2 cases to 15 cases. Santa Ynez, we went from 2 to 9 cases. Santa Maria, we went from 47 to 75 cases. Orchid, we went from 14 to 22 cases. North County unincorporated, we went from 4 cases to 11 cases. Noteworthy is that we only saw 2 areas with decreases, and that would be Isla Vista from 37 cases to 13, and Lompoc from 25 to 20 cases. With regards to hospitalization for the same period, as I mentioned earlier, we went from 10 to 13 cases. In ICU, we went from 3 to 5 cases. This data is available on our new community dashboard via publichealth.sbc.org. Blueprint for a safer economy. So I'd like to start off the update with a reminder that for widespread, the purple tier, we are assigned this tier when we have more than 7 daily new cases per 100,000, or our testing positivity rate is more than 8%. To maintain our previous red tier, we must have had just 4 to 7 daily new cases per 100,000, or the 5 to 8% testing positivity rate. So yesterday, Governor Newsom announced the utilization of the state's emergency brake, which was built into the California Blueprint for a Safer Economy. As you recall, is a dimmer switch. On Sunday, CDPH noted that California increased from 6,000 daily new cases to 11,000 daily new cases in just a span of few days, and more than 1,000 hospitalizations in 1 week. So due to this unprecedented surge in the rate of increase of cases of COVID-19 in every region of the state, the California Department of Public Health implemented immediate changes to its tier assignment process. So what's new is this. Tier assignments may occur any day of the week and may occur more than once a week when CDPH determines immediate action is needed. And we saw that typically we get tier assignment on Tuesday, and we received it on Monday yesterday. Counties may be moved back more than one tier if CDPH determines a need for intensive intervention. Key considerations will be the increase in new cases and/or testing positivity, public health capacity, and other epidemiological factors. Counties may move with 1 week of worsening metrics, as opposed to the usual 2 weeks during times of stability. In light of the extreme circumstances requiring immediate action, counties will be required to implement any sector changes the day following the tier announcement. County requests for tier adjudication will not hold the county in the current tier during the adjudication. Given the current environment of rapid escalating cases and widespread disease transmission across California, tier adjudication requests are unlikely to be approved. So our tier assignment, as announced yesterday, we are in the purple tier with 7.1 adjusted case rate for the tier assignment. We were adjusted down from 7.7 because of our continued testing in our county exceeding the state median. Our testing positivity rate is at 2.7. The state did not calculate the health equity metric because no county is moving forward. I wanted to show you what a difference between last tier rating and this current tier. So on the left is the tier assignment 1 week ago. And our state was pretty colorful with many in red, orange, and some in purple and some in yellow. This week's current assignment is on your right-hand side. So it's mostly purple this week. We have 40 counties that were moved backwards and 18 counties that stayed the same. So statewide, 41 counties are now in the purple tier, 11 in the red, 4 in the orange, and 2 in the yellow. And some counties were moved back 2 tiers. Our case rate trend. So again, here we went from last rating period from a 4.3 to a 7.1. That's a pretty significant jump. Testing positivity trend. We went from 1.8 last rating period to current 2.7. So we're seeing the upward trend here as well. I want to pause. Earlier in the presentation, I showed the areas where the cases are occurring. This is another perspective on the occupation of our COVID-19 cases during the same rating period from November 1st to November 7th. And we call this our week 45. So our clerical
Excuse me, Mr. Chair.
Yes, Supervisor Adam.
Yeah, yesterday, Dr. Del Reynoso, you told us that the agricultural tier went down because you had engaged in a lot of outreach out there.
I believe that it is a result of a combination of things, a result of collaboration between growers, between public health, between ag commissioner, and between all the community support, community partnerships.
Why is it that that we haven't had those kind of partnerships with clerical and management?
So clerical management is, it includes everyone who works in an office, and we have done our sector outreach to the businesses, to the essential businesses that have come back. And it looks, we will be re-looping and doubling down and reaching out to all of our sectors across the board on that. There was a recent CDC report that showed that it is better to telecommute and to that returning to work in an office may increase the likelihood of exposure.
So you think everybody's returned to the office already?
I think what we're seeing in our contact investigation is that as people return to work, they are quite comfortable with their colleagues, and some may forget that, some may identify their colleagues as a stable cohort and take off their mask and not maintain the physical distance required, as well as not being diligent in washing hands and disinfecting their work environment. And we saw that.
And you think that, sorry, go ahead.
I'm sorry, and so we gleaned that from our contact tracing.
Okay, do you think the same would go true for retired and unemployed?
I think and that is, the retired and unemployed is a group of people, and that we can only say that they have discretionary time on their hands, and that it is a group that we need to reach out to and make sure that they are hearing the messages that we are putting to all the other sectors.
Okay.
Thank you, Supervisor Adams. Supervisor Williams?
Well, I think this gleaning as much information out of this is really important. And it seems to me, as someone who studies very closely how many people are commuting from Ventura County to Santa Barbara County with my scientific research on the freeway every day, that there definitely has in the last 2 months been a return to normal traffic patterns, which corroborates the idea that more people are in the many office and knowledge-based jobs in Santa Barbara and Goleta. Either that or there's a lot more people traveling than ever before. So I do think that's combined with that number, which is different than what you presented before, meaning this is a new number. And so, I guess what's most dismaying about the increased rates that we have is that we haven't made any relaxation of our policies. And we haven't even gotten to the holiday weekend yet, right? So that's what especially is, I would say, dismaying. So I do think it's incumbent upon us to figure out as much patterns from this as we might. I also don't want people to figure out false patterns. You mentioned yesterday that the majority of the folks who are under 18 are teenagers, not small children. Is that, I know you're not allowed
That
to
is
give us the
correct.
exact numbers, but is that correct?
That is correct.
And any other differences between this and the previous chart? I seem to remember, again, adding to your point, that in the last cohort of contact traces, the number for labor unskilled worker was much higher. So we've made progress there.
Right.
Is there anything else that has come out, either anecdotally, that isn't represented on the chart about the contact tracing?
Yes, so let me take you to a new slide. I apologize, this is a late addition, so it may be out of sequence in your packet. So this is the previous slide, but within context of the whole pandemic, in context of the numbers that we have since March. So I'll start with the college and university students. So during this week of, this week 45, and again, that's the period from November 1st to November 7th, it was 16.5% of our 241 cases. But if you look at the whole pandemic, they accounted only 6.1%, so they far exceeded. So this graph shows you in context what is happening currently within context of the whole pandemic. The restaurant, bar, food preparation throughout our whole cumulative number is the 6.5%, but during the week 45, it accounted for 2.6%. The clerical management, as Supervisor Adam noted, was 10.4 or is 10.4% during the whole pandemic, but accounts for 19.1% during this week 45. And we see that in healthcare. The under 18, we saw that at 15.5%, which exceeds the overall 13.1%. And here is the ag. So from March until now, we can account for that it is 18.7%, but currently in week 45, we saw only a 4.1%. And I do say that this is as a result of our partnerships with the sector, the growers, as well as the farm workers, as well as the community partners.
This-
Because
I just wanted to note, this is an enormously useful slide. You know, shows where we're making progress and where we're losing ground. And obviously, we're losing ground among office jobs. So is there more that the department can do to reach out to, I mean, you know, typically these operations are between 20 and 300 employees. There's a discrete number of them out there. Is it possible to step up outreach efforts in an effort to return to our previous level of telecommuting, or at least to some happy medium in telecommuting? Because I would warrant this means that
Right.
people are telecommuting less.
Right, so two things. We also find this slide very useful, and given the uptick in our cases, we will be tracking moving forward this type of data and presenting it to your board. With regards to outreach to the clerical management, I think one is telecommuting, but two, I also think that it is really reminding everyone to wear their face covering and maintaining their distance, even though they have been working with colleagues since March. I think the reiterating of what the tools that we do have at our hands will go far.
Supervisor Hartman?
Oh, I was just puzzled by the college university students. In the previous slide, I think they, at least in Isla Vista, the numbers had gone down almost 56%, which is, again, speaks to the power of partnerships and really intensive outreach to communities. But here, it's 16.5.
So this is also, we're seeing the earlier slide is over a longer period. And we saw a decrease in Isla Vista, but not all college and university students reside as well in IV. So what does it mean by moving back to purple tier? It's been 8 weeks more since we've been in the purple tier. So I'd like to just remind your board what it means to us. So for critical infrastructure, nothing changes. For gathering, this is the state blueprint tier, but I X'd it out because it is small gatherings is not permitted in Santa Barbara County per Health Officer Order 2020-12.4. And I do want to say here that the state acknowledges that the spike in cases can and probably most likely due to small gatherings that are occurring throughout the state. So here we will stay steadfast and mitigate our increasing cases by continuing to not permit private gatherings. The two significant change on this page is that all retail will need to reduce capacity. So we will need to reduce from 50% back down to the 25%. And museums, zoos, and aquarium will have to maintain outdoor operations only. They will have to cease indoor operations. On this page, the three significant changes: places of worship can now only happen outdoors. Movie theaters can only happen outdoors. And gym and fitness centers can only happen outdoors.
Question, Mr. Chair.
Supervisor Lavanino?
Thank you. Can we go back? Yeah. So what I've heard most from constituents of, because purple's different than when we were in purple last time, but the burr under the saddle, which I totally understand, is places of worship. And everybody's struggling to figure out what is the justification that allows you to be able to go into retail with 25%, but you can't go to your place of worship. You have to be outside. And, you know, my response to them has been, well, you're going to need to do what the nail salons did and the barber shops and the folks that do hair, and that is they pressured the governor into reducing that and bringing those back online. So I'm curious what you're hearing from California Department of Health of what's the justification for not allowing people to be able to do the same thing you're going to do in a different building. Instead of shopping for something, you're going to church. It doesn't seem to make sense.
So places of worship since the beginning of the pandemic has always been a hot topic for the field. And what I have heard is unease with the context how people gather in an indoor church. So you have church events, church services that may take longer than a 15-minute encounter. It could be 2 hours. And within a church, indoor church event or church service, you have familiarity with one another. And so quite possible the social distancing is not possible, nor the face covering is adhered to. So those are some of the concerns I've heard. In addition to that, there have been published outbreaks, large-scale outbreaks from church events, church gatherings in our state as well as in our country. And here in Santa Barbara, I recall our first set of cluster cases was due to an inside church event. So those are some of the concerns that I've heard.
Okay. So I guess this question for Mr. Gazzoni, I know that gyms have actually filed lawsuits against the governor. I'm curious if we know if there are any cases of churches moving in that direction.
Chair and supervisors, there have been several cases litigated in farther south in Southern California, and in each of those, the county and state regulations were upheld. Those have occurred going back maybe 4 months ago, 3 months ago, and 2 months ago. I'm part of a work group that meets weekly on this, and we keep tied in with that. The most recent litigation that's going on that you may have seen involves Sutter County, not with churches, but with executive order there. But the church restraints in farther south, as well as Ventura County, have been upheld.
Thank you.
With the sectors listed on this page, the two significant changes in the sectors, restaurants can now, can only operate now in an outdoor setting. And bars, breweries, and distilleries are closed unless they provide meals at the same time as the alcohol sale, and they must follow the restaurant guidance, which is again outdoors only. No change in these sectors, and no change in among amusement parks. With regards to school guidance in the purple tier under emergency break, the emergency break does not alter the state guidelines governing school reopenings. Schools that have already reopened may remain open. These schools will need to follow the guidance provided by CDPH when determining when or if to close. Schools that have not reopened may provide in-person instruction under the elementary school waiver process or through small cohorts. Otherwise, schools may not reopen for in-person instruction until the county has been in the substantial red tier for 2 weeks. The health officer order was issued yesterday, and there's a typo here. It will be effective tonight at midnight, so that should say 11:59, not 12:59. So the new health officer order to implement the purple tier again takes effect tonight at midnight, 11:59. Because of the rapid increase in case count and hospitalizations, the state is requiring, directing, mandating that next day action will need to be taken by counties. Business sectors affected by backward movement to a more restrictive tier must modify their operations. We recognize that this news takes some time to filter throughout our community, and such change in business practice is not easily achieved overnight. We ask that our businesses make these changes right away, but we understand that it may take a matter of 2 to 3 days for universal compliance. We have initiated outreach and education and will continue these efforts in the next few days. Additional guidelines that may come from the state include a curfew advisory at 10 o'clock, and it may be a requirement for some businesses to close at a certain time. Yesterday, the governor did release an updated guidance on facial coverings, and we anticipate that additional guidance for restaurants with the ventilation, the placement of the tables, and hours of operation may be coming, as well as a posting of capacity under the purple tier at certain essential businesses. Next, I'd like to briefly update your board on vaccine planning in our county. For the past several months, we have been in conversations, in discussions, in trainings with CDPH, and we have initiated a local work group to include hospitals and outpatient clinics. It includes main divisions within our public health department. The work group includes fire agency, as well as our partners in community health centers. It also involves our County Joint Information Center, as well as UCSB, residential care facilities, pharmacies, the Vandenberg Air Force Base, as well as other community partners. And the objective of the work group is to coordinate and share information between public health and our healthcare partners on who and how we will be providing the vaccinations. It is also to coordinate a public information campaign so that our community can get accurate and timely information about the accessibility and the method for which COVID-19 vaccine will be distributed in Santa Barbara County. And to provide coordination with all the operational resources so that we can indeed offer and ensure vaccinations to the priority populations and the general public. And we intend to bring back to your board a full presentation about our progress on December 8th. On community testing, we continue with community testing at 3 OptumServe sites in Santa Maria, Buellton, and Goleta. The state has offered us additional spots, so now we are offering 165 appointments per day at each of the site. So that means a total of right under 500 total tests per day at these 3 sites. The utilization in Santa Maria and Buellton averages about 100 appointments per day. And this is a worry for us because we need to maintain the exceeding 85% utilization in order to maintain these testing sites. With regards to our Goleta site, we have been routinely full, starting from when we were at Earl Warren and now at Goleta. So South County testing site has routinely been full. We asked the state for an additional day per week, and we were recently, last week, given that. So the Goleta site will be open 6 days a week. The additional 5 extra days per month means that we have 825 new appointment slots available, and we hope that this will offer community members more opportunities to test. And coming soon in discussion between our department and the state is developing the public health sponsored walk-up sites. We have that is currently in operation, but restricted to essential workers, and utilizing our own registration system and our local lab processing. We will be partnering up with the state to utilize the PerkinElmer as well as the state's registration platform. In addition to that, we will be partnering up with various sectors, healthcare sectors, as well as the business sectors for testing. And these are the 2 additional testing opportunities that the department will be developing with CDPH in the next few weeks. And that concludes my update.
Thank you, Dr. Doronus. Are there additional questions?
Yeah, I have one, Mr. Chair.
Supervisor Adam?
I assume I'm going. Dr. Del Reynoso, how many deaths have been attributed to influenza in the last 3 months? Do you know?
I am sorry, I don't have that information, but I'm more than happy to look it up and send it to you.
Okay, that'd be fine. Thank you.
Thank you, Supervisor Adams. Supervisor Williams?
And
Supervisor Lavanino.
thank you, Mr. Chair. And it's not so much a question, but something I brought up yesterday, and I just want to do this in a public forum as well, is to request that we also, and I don't know if it would be part of this update or not, but at some point bring back a board item that looks at the economic impact that this is going to bring us. Just reading recently about the tsunami of back rent that is due, mortgage delinquencies, bankruptcies, and really how we are going to look at that and how we're going to prepare for that in the next coming year.
Thank
you, Supervisor Levity. I know the staff is planning to do that. Supervisor Williams.
Well, I wanted to just ask a question about harm reduction during Thanksgiving for the benefit of the public and anybody who's watching, and then make a comment. While we have remained very restrictive on gatherings, i.e. that no household gatherings are permitted under our rules, we know that some people are going to gather for Thanksgiving, right? And so I wanted to ask you about what is the harm reduction strategies that people who are thoughtful should pursue? And you know, the only thing that I thought of, and maybe you could flesh this out in a more substantive way, is that there's really no way that's safe to attend a gathering because you don't know what other people have done, but there is a way to make it less likely that you would be the one that would transmit, which is to isolate yourself before and after any Thanksgiving celebration. Can you talk about that a little bit as something that people, for whatever reason, if they're not going to comply or if they're going to another place that doesn't have the same rules that we do, how they could still take some steps to make it safer for other people?
Yes, so you mentioned self-quarantine before you visit family in Santa Barbara. I think that is one good strategy, but I also want to caution that the state did recently release a travel advisory. Basically, unless it's essential, unless it's critical, stay home, because there is widespread infections throughout our country. The other thing with harms reduction is the event, the gathering itself. Outside is always better. Inside needs to be really well ventilated. A shorter meal is safer than a longer 6-hour Thanksgiving shindig. And no sharing of utensils, passing plates, reducing the touch points is another safer practice during a Thanksgiving meal. Also, maintaining physical distance and maintaining the mask wearing unless you are actively eating. And I think there's always an element in a private gathering, especially a festive occasion like Thanksgiving or the upcoming December holidays, is where it's fun. You're with family, you're with loved ones, you want to celebrate. So with the use of alcohol, and as the evening or as the event progresses, the reserves are down. And so I've read papers and have heard that as the evening or as the event progresses, the reserves are down, people are no longer social distancing, wearing masks, the volume of conversation goes up. Those are not safe during this holiday season. So I would want to encourage everyone to really rethink Thanksgiving. And on a personal note, Thanksgiving happens to be my daughter's 16th birthday, and I seriously thought we were going to be in the orange and had organized a small get-together. And as we started trending upward, it was incredibly difficult, but that had to be canceled. So Thanksgiving or other big life milestones, we need to rethink how we do that. We can still share, we can still partake, but perhaps virtually outside, and keep it small and keep the exchange to a minimum. So those are all safer practices, and we have included this on our website as well. And we have made videos, we've written as well the guidance, and it's all available on our website.
Well said, and I appreciate your leadership in setting the right example, but also telling people other strategies that they can employ. I think both are needed. I want to say just, I know people can react to these, the governor's, break on reopening in very different ways, and I've gotten emails with very different reactions from people in different situations. But I hope that people will continue to take strong steps to reduce transmission and keep an eye on the bigger picture. There are some really important aspects of our society that could be threatened by increased transmissions, not just our health, not just our lives, but also kids' education, which I'm concerned could be collateral damage if transmissions continue to spread, and obviously people's jobs and businesses. So I think regardless of people's ideological framework or their reaction to these measures, good or bad, perhaps we could stay united in the need to reduce transmissions so that we can either save lives, save our kids' educations, save businesses, save jobs.
Thank you, Supervisor Williams. Supervisor Hartman?
I had a question and a comment. The question, and then I'll make my comment and you can respond. About young people who are living in Isla Vista, for example, going home, what is our recommendation there? My comment is that on the radio, when I commute in the morning, there's usually something about COVID. There was a heartrending story about one family gathering lost 6 people. So that's the risk if we get together. We want very desperately to be connected to our loved ones, but we don't want to make a tragedy. And so each of us has to really follow through with this prevention, the reducing the harm that you suggested. The other thing is, we're hearing every day about new vaccines. I heard Anthony Fauci today saying general population as early as the end of the first quarter next year. So we don't have to do this forever, but we have to do it for a few more months. And so we have to hang in there and hang in there together.
Supervisor Hartman, through the chair, with regards to college students living in IV or at UCSB, we have been in partnership with UCSB, and I know that they communicated with their students that if you go home for the holidays, consider staying home. And that is a consistent message that other universities have been sending to their students as well. With regards to the vaccine, yes, that is the light at the end of the tunnel. We are excited about the efficacy of the 2 lead vaccines. And that's why we've been working really hard with our community partners to make sure that when we get our first allocation, that we can ensure operational efficiencies, that we have the resources to roll it out to the priority groups, and then in anticipation, come spring, be able to roll it out to the rest of our community members. But like you said, until then, we need to be diligent and persevere in wearing our masks, maintaining our distance, hand washing, and rethink gatherings. And I just want to make a point here that a lot of times people may think that, oh, I'm not attending a gathering because there's only a few of us. Well, through our contact tracing notes, we have seen a small gathering, small as 5, all be exposed and all become cases. And so really rethink about gathering with anyone outside your household.
Thank you, Dr. D'Arvinoso. Do we have any requests to speak in public comment?
Chair Hart and members of the board, yes, we have 3 requests to speak on public comment on this item. And we will begin with Andy Caldwell, to be followed by Renee O'Neill.
Chair Hart, members of the board, Andy Caldwell representing CoLab. I think that people are not just infuriated, but they're completely disheartened by the governor changing the rules once again as you know from your staff's presentation, we're at 7.1. And under the old rule, we should have been able to stay at 7.1 for 2 weeks to try to get back to 7.0. But he changed the rules. And I know that to some degree, some of you are politically aligned with the governor and you don't want to publicly criticize him for that reason. I also know that you're co-opted, that he has punished counties financially that bucked him and stood up to him. But the fact of the matter is these businesses aren't going to be around much longer. Restaurants have one of the highest failure rates of any business sector there is, and they can barely make it when they are at full capacity, let alone zero capacity indoors, and as we go into the winter months. We wish that you would push back on the governor. 0.1, there would be a darn good chance we could drop that 0.1 within the next week or so. He's got to quit messing with us. And as I've been telling you since last April or May, I'm not a COVID denier, and I certainly understand it's deadly. But the thing that's wrong, you were set up to fail. He forces tests, and he counts as positive people who, quote-unquote, test positive, but they're not sick. And we're testing way more. I sent all of you a chart. We're testing way more than 2 countries that have over 1 billion people each, China and India. We're testing more, and we're counting all positive test cases, even though one of my guests on the show called it viral debris. They're not sick. They have viral debris that can live in your nostrils for weeks. We're counting those as positive when the people are not sick. The first criteria he used originally was hospitalizations and deaths. Those are the only 2 criteria that matter when over 90% of the people are going to be asymptomatic or mild, and the death rate, except for the elderly, is 99.99% recovery rate for everybody under age 70. 99.99%. We need you to start you were elected to represent the people that live here, not to be a representative of Governor Newsom and this arbitrary and capricious standards, which has changed. How many times has he changed these standards and these protocols and all the rest? It's constantly changing. This is, if your business, if your board was having to lay off as many people as the private sector, I think you'd be singing a different tune. But somehow you've proven yourself immune. We can't tell that you've laid off anybody. And your revenues seem to be made whole by the governor, but the private sector is dying out there. I've been representing them 30 years. I've never seen anything like it. Please do something. Thank you.
Thank you, Mr. Caldwell.
And our next speaker is Renee O'Neill, to be followed by Terry Strickland.
Good morning, supervisors and community. This is Renee O'Neill. I would like to propose encouraging people to consider associating wearing masks with wearing seatbelts. Both are proven to reduce loss of lives. It has become second nature for most of us to buckle up, so I propose that we now muggle up. We, the people, need to accept the fact that wearing masks helps reduce risks and loss of lives by simply covering our all-American mugs. So come on, fellow Americans, please wear a mask, and to coin my new phrase, muggle up. And I'm asking you to muggle up so that we can snuggle up sooner as opposed to later. On another note, I read an article in the Newsmakers newspaper today from Jerry Roberts that said Governor Newsom attended a birthday party on November 6th. His friend Jason Kinney turned 50, and he went up to Napa and to a restaurant with at least 12 people from different households celebrating his friend's birthday. This, to me, is hypocritical. and not productive in showing that we should be following the rules that he has subscribed. And so, it's a matter of do as I say, not as I do. I liked something that Supervisor Hartman said, and I thought of this when you said this, Joan. It reminded me of a song that we used to sing, "The more we get together, the happier we'll be." Well, I think we should change the words today to say, "The more we get together, the unhealthier we'll be." And so I'm going to read a little bit more of the letter I submitted. I do not consider recommendations and or laws that ask us to wear seatbelts or masks as a punishment or an infringement on our freedom. This pandemic will fade into history. The sooner we can reduce the spread of coronavirus, the sooner we can get back to our normal lives. Meanwhile, our first responders and medical personnel are being overwhelmed. Their lives are on the front line, and they're doing their best to keep up with escalating numbers of cases that could have been prevented by simply wearing a mask. Is it truly too much to accept the fact that by wearing a mask, we can help prevent spreading this disease? When did Americans stop caring about their fellow Americans or believing that we have the ability to overcome anything as a united nation? We've always pulled together during challenging times, and we can pull together through this pandemic, too. Thank you for listening, and happy 16th birthday to Dr. Reynoso's daughter. I think you should call the governor and ask him to put on a party for her up in that fancy Napa restaurant. All right. French Laundry in Yountville, Napa. Have a good afternoon, and I'll see you at Department 2.
Thank you, Ms. O'Neill.
We will now go to Terry Strickland, and we just had an additional request to speak by Peggy Wilson. Terry?
Chair and board, well, I'm about tired of being reprimanded to wear a mask. 99.9% of the people I know wear a mask even when they don't want to, wherever they're supposed to be wearing them. Everybody's doing what they're supposed to be doing, and I'm just a little tired of being reprimanded about this week after week. Finally, something I disagree with Andy Caldwell about. I'm not disheartened about the governor's new orders. I'm very upset, and I know I speak for hundreds of county residents. It's been 24 hours since we received the governor's new restrictions, and just to go over the numbers again, for our county of 450,000 people, we have 13 hospitalized in a county of 450,000 people. We have 255 active cases in a county of 450,000 people. We have 133 deaths in a county of 450,000 people. You know, I'd like to know why the Board of Supervisors continues to go along. I mean, I get it, what Andy said about how many of you are, you know, in line with the governor's politics and whatnot, but you know, you were elected to and hired, the ones that are hired, to serve the people of this county, not the governor in Sacramento. As far as businesses, they can't operate this way, not knowing from day to day what the governor's going to do next. You know, and if he's going to shut down restaurants, why didn't he just say that yesterday? I think it's because he's waiting to see how much pushback he gets, because we know he will back down when that happens. One of those charts showed restaurant numbers, people supposedly infected at restaurants. The numbers went down. Then why are restaurants being punished with pushing people outdoor dining again when we're expecting colder and wetter weather, of course? I wish the county would think outside the box, because what you're doing may not be the best way to do it. You know, social distancing is happening in churches, Dr. De Reynoso. I go to church. I know. Churches are doing everything they can. And now there's pushed outside again. I hope they fight back. You know, what does it mean to be in the purple tier for the business community? It means shutdowns, permanent closure of businesses that people have put their life savings and their hard work into. You know, what do you expect a small little restaurant or any a business in Orchid or Montecito or anywhere to survive on outdoor dining? Businesses are going to be closing right and left. They can't take this again. These are real people. These are not just numbers on your charts and spreadsheets. As I've said before, you are all collecting a paycheck each and every week, as you have since this began. The same cannot be said for the citizens of this county. I have a question, and Supervisor Hartman said only a few more months. Well, it was only a couple of weeks, 7 months ago. Some people and businesses will not survive another month. And Supervisor Lavinino asked a great question. How do you justify these restrictions on small businesses, churches, etc.? I implore you to push back on the governor for the sake of the mental and physical well-being of the people of your county. Thank you.
Thank you, Ms. Strickland.
And we will go to our final speaker, Peggy Wilson. Peggy?
Yes, I'm here. Can you hear me?
Yes, we can. Thank you.
Okay, thank you so much. I just learned about this right now. I've been so busy fighting election fraud around Dominion software. Turns out Santa Barbara is using Dominion software also, but that's another story. So here we are again today, and you are trying to enact through the governor more restrictions on people. I want to say, again, I totally support everything Andy Caldwell said. And I want to start with going to the website to find out deaths and hospitalizations. Somehow that's gotten pushed to the very bottom. Deaths and hospitalizations for COVID is down. Okay? You are enacting on people rules and regulations that are really unconstitutional. Never in the history of our existence have we treated a virus this way. Yes, it has issues. Yes, it can be deadly if you are a certain age and older and have comorbidities, and people are doing that. Social distancing is happening, but you cannot keep shutting down businesses. As the lady said before, and Andy did too, you guys are still getting your paychecks, you know, and if you're walking in lockstep with Governor Newsom, well, God bless you, but to the extent of what's happening to people, kids at home, I'm volunteering in a church now where kids can go because otherwise they'd be home on Zoom alone. And this is absolutely ridiculous. You guys, I've talked to you before. I've commented. I don't know if you're really looking outside of the box. This is ridiculous what you're doing. Deaths and hospitalizations are down. Slamming people, putting them in boxes and saying you can't do this, writing them tickets. This is like not a free society. And yes, we are protecting ourselves. Businesses are protecting ourselves, but why is it selective businesses and selective things that need to be shut down, like churches? But yet casinos are open. We lost that lawsuit up until what is going on? You guys are elected public officials to do what's right by the people. Now, some of you might think, oh, well, we've got to lock people down more, and all these cases are up. Of course cases are going to be up because testing is up, but it means nothing. Cases mean nothing if you have looked at the evidence from other doctors that aren't taking the orders from Newsom and most of these Democratic states where they're saying cases are the thing that make the difference. Cases don't. My husband is a virologist. Cases don't make the difference. Hospitalizations and deaths do make a difference, and that is clearly down here. We are not seeing that. We are not in pandemic mode, and you guys are acting like it. Please stand up for the people of this this county. People that are going to work every day, but doing the best they can. Businesses that are shutting that will never open again. People that are depressed. Kids that are this fear. And it's not, I don't think in the whole state there's one child under the age of 19 or something that got COVID and died. I mean, a complete anomaly. Your stats come from the top down, what Governor Newsom wants you to do, and you do need to think outside of the box for yourself. You do need to stand up and push back. You're elected to do that. I'm incensed. I'm absolutely incensed that constitutional rights keep getting squished by public officials such as yourself. I'm incensed. We have a Bill of Rights. We are the sovereign, not you guys. Not Governor Newsom, who has his winery open and who's having parties and who's done what he wants. You guys.
Thank you, Ms.
What is
Wilson.
wrong?
Your time, unfortunately, is up. So thank you very much for your comments.
And that was our final speaker.
Supervisor Williams.
Well, I very much understand and empathize with the frustration that's been expressed, but I do think that people are under a misimpression of what is happening here. We are not sitting in a room formulating these laws. We, and in this case, I suppose it's not even we, it's the public health officer in consultation with other local physicians and the public health director, is issuing health orders that are complying with state law. This is state law determining these things. And in our constitutional framework, yes, we are called upon to disagree, but we are also called upon sometimes to uphold the law. That is the rule of law. We are not, it's not incumbent and it's not our mission or our role to break the law. And the rule of law is what holds this society together. And I'll just say, I don't think we've agreed with all of the priorities or all of some of the different standards that sometimes you scratch your head at. I agree that we need to take strong steps to limit transmission. But I, more than anything, believe that decisive action to limit transmission is what is needed right now to hold off worse results, both worse results in terms of hospitalizations and deaths, which are the indicators we should be looking at, but unfortunately are not leading indicators. They're trailing indicators, so you can't really like look at those numbers and say, oh, okay, let's course correct. And decisive action is taken to avoid greater closure of a society that will have more impact upon jobs and our kids' education and upon businesses. I do think that it is sort of frustrating sometimes that the rules keep changing. If it's frustrating for us, then I can only imagine how frustrating it is for the businesses themselves. And under the way that the framework worked before, we would have another week or two to course correct before we were moved into purple. And largely that means the biggest difference is that restaurants and places of worship have to move back outside. But I would maintain that we still have some good weather. We can still try to make the best of these moments and still work diligently to limit transmission. Also, in defense of the governor, when I'm criticizing some of his moves, I want to say that his response to the criticism over the birthday party was totally the right message. He said, I was sending the wrong example. My bad. He didn't try to get defensive or defend himself. He said it wasn't the right example. And I think that was commendable that he took responsibility for it. And taking responsibility is probably the best thing we all can do. none of us can be perfect. One speaker said we should wear masks like we're wearing seatbelts. I would say maybe we should be wearing masks like we're wearing pants. And you know, it's hard, you know, I'm one of those people that's like, it's hard enough to remember keys, wallet, and phone coming out the door, let alone a fourth thing. But there are practical and easy steps that we can all take to have responsibility and make the situation better, both for people's lives and for their businesses and their education.
Thank you, Supervisor Williams. Other comments from board members?
Mr. Chair.
Supervisor Adam.
Yeah, you know, I'm also getting identifying with one of the speakers. I didn't catch her name, but I'm getting really tired of being the attempt to shame me for disagreeing with this strategy. You know, and I've been arguing with this since March, but we have demographic and medical comorbidities that are well known, but we won't talk about them. And we've decided that we're going to do this box the virus strategy rather than try to manage the people who are the most vulnerable. And so we're going to act like everybody on the planet has an equal chance of dying from this thing, which is absolutely not true. And you know, if there's a certain segment of this society, which I think there's about half of, that disagree with the other segment of society that wants to that's very fearful and wants everybody masked up to reduce the risk to themselves. I get it, but that doesn't mean that we don't care about anybody. And this is this idea that's you know, it's chilling on free speech. It's chilling on disagreement. It's disrespectful of a good half of our country, and it's contributing to the decline of this, especially the civility of this society, where we can't have a legitimate discussion, because half of us decided that they were right and the other half is wrong, and that's all. So I think we really need to rethink that. You know, and I think that you have to be, you know, talk about being tolerant. Let's tolerate people making their own choices, and you know, let's trust people a little bit. And instead of being big government and trying to be everybody's mother, and you know, I hope that people don't all obey as ordered. I think that's what retains America as America, when there's a healthy amount of civil disobedience when the rules are unreasonable. And I think at this point, it's just shocking to me that we haven't seen more. And you know, as it goes on, it's going to become less and less supportable. These draconian measures that we're engaging in are going to become less and less supportable as this death and hospitalization does in fact get closer to the flu, which, by the way, I have it on good authority that our dashboard lists 0 influenza deaths. So that's curious, because when we first started this thing, the testing revealed that there was 8 times as much flu as there was COVID. So, you know, it undermines the case for the draconian measures, and I think, at least in a good big segment of this population, it undermines the confidence that we're being told the truth, and that's the most destructive thing of all.
Thank you, Supervisor
Chair?
Adams. Supervisor Levanino.
Thank you. I wasn't sure if this was going to be an appropriate action, but I do notice that we are agendized to provide any direction as appropriate. And I don't know if I've got the votes, but I think, it's time that I think the purple tier was amended when we left it last time, and obviously these criteria can be changed by the governor. I just really didn't hear anything from Dr. Do Reynoso that she was getting back from the state on why churches would be singled out more so than retail. The time that you spend there maybe could weigh in some on it, but I think at a time it's critical right now when people feel so disconnected from their community that they have that time where they can go be at peace. And I'm glad that there are people praying out there for, even for whatever their needs are. But I just think this time's so critical to be able to tell people now that we're basically sending people back outside for church. I just think it's a bad message. And I would like staff to craft a letter asking the governor to reconsider churches and places of worship to just have the same, not to single them out and make them any better, but just that they're given the same latitude that Costco is, that Walmart is, and that they're basically taking the same approach as retail. So, and to those that have restaurants, I hope you're part of the California Restaurant Association. I know when I was in Sacramento, that was a strong lobby. I'd like to see, also the wine and spirits folks. You could partner with them to try to get some indoor dining back. But that's kind of the way this is going. Is where the pressure comes, you see the governor make some moves. So personally, I'd like to see the county speak out in support of places of worship, and for restaurants, I think you need to go through your appropriate lobbying avenue. So when we get to the point where there's a motion, I know we haven't heard from every supervisor yet, but I'd like that to be considered in a motion at some point.
Could you put up, Supervisor Hartman, you had a comment, or is that?
You can go first.
Could you please put up chart number 13, slide number 13? I think the reason why why the governor has done what he's done is because if you look at this chart and you compare it to the rest of the country and the world, the spike that is just beginning now, where we have gone up from 4.3 to 7.1, is ending up with a spike much higher than the first spike on this graph. And this is the moment to maintain our vigilance and our resolve and control that from happening or not. And there are 247,000 deaths in the United States from COVID-19 today. It is projected to go higher than all of the deaths that American service people have lost their lives in wars in the 20th century over the next few months. And we are being asked to wear masks and avoid each other for a period of time to avoid those consequences from happening to our neighbors, friends, and family members. I don't think this is extreme or unwarranted in response to the threat that we are facing. And I think this is the perfect moment for us to decide what side of that effort we are on. Are we going to stay the course and protect our residents and neighbors, or are we going to quit because we are tired? The virus isn't going to stop because we are tired. Supervisor Hartman.
That raises a couple of things. I used to run marathons, and about 17 miles, you keep asking yourself, why am I doing this? The only way you get through is saying, I'm never, ever going to do this again. And that's where we are. But we can see we have a vaccine coming, and we just have to persevere. People keep talking about, we've done pretty well here, so why are we in our county having additional controls? And I think Chair Hart said that. I'm reminded of the lily pad. There's a riddle that the lily pad doubles every day. And on what day will it cover half of the pond? It's the 29th day. That's how you understand exponential growth. So why we are looking at case positivity rates rather than hospitalization is so that we can avoid that big spike in hospitalizations that they're seeing all over the country. So in a sense, we're being, I think, a victim of our success that we've kept the rates down, the hospitalizations and deaths in our county, but what I've read is a fourth of our population has various conditions that would be considered comorbidities. We also are finding out that there are long-term effects, and it may qualify as a pre-existing condition going forward. It's not the flu. And I heard from some people that the reason the flu is lower this year is because of all the precautions that people are taking. So it's a long, rough haul. It's hard for everybody. It's disheartening. It's really hard. We thought we were going to be in orange, and here we are, bumped back to purple. But none of us has ever been through anything like this, ever. And we're learning as we go, and we're making the very best decisions that we know how to make. And I think we just have to keep faith with each other and hang in there a little while longer. Thank you.
Thank you, Supervisor Hartman. Supervisor Williams?
Well, I want to agree with my colleagues, but maybe I would just entertain the alternate route. The alternate route, if it leads to more transmissions, will not make things better for either our health, our businesses, or our jobs. It will just get us into a place where larger measures are needed. And so I do think we have to keep doing what we can to reduce transmissions. I do want to say that I agree with Supervisor Lavadino that there are inconsistencies in the framework, and I could support a letter asking the governor to have greater consistency between, say, places of worship and retail. I mean, if my values are that the values that this country holds dear means that education should be at the very top priority, and that places of worship rank higher than commercial activity. But that's just, and so I don't know if that's everyone's values, but I think that there is a case to be made that of greater consistency is needed in the framework. But I would also urge stronger measures on office settings. Those numbers that was presented are very different than the numbers we've had before. And to me, they represent a trend that has been happening all summer long as more and more people have been reducing their telework or coming back or to normal activity in their place of employment. And particularly, there are certain types of businesses here in town where telecommuting is very possible. And I think probably we need to start with the outreach, but I would support if the public health officer decided to take stronger measures, including telework mandates, if that was necessary on office-based jobs. So I would agree with Mr. Lavadino's desire for a letter on consistency between retail and places of worship, but I would also at the same time urge we take a more activist approach or a more active approach with office-based employment. That's what the transmission numbers I think, lead us to believe is one of our places of real problem.
All right, so if it's okay, Mr. Chair, I'll make a motion.
Yes, please do.
Okay, receive and file this update, and then have staff craft a letter to the governor asking for the purple tier to be amended to allow churches and places of worship to have the same provisions as retail. And then C, the CEQA finding.
Could we have 2 votes?
Yes, let's separate out the receive and file
Sure.
and the super
Okay.
findings.
Second.
All right, so I will make a motion to
I'll
receive and
just-
file the report and to have C, the CEQA finding.
Well, Mr. Lavignon and Ms. Hartman, I'd actually ask if you might be able to add it in one motion and add directing the Public Health Department to do additional outreach to the office sector in the county to address measures to reduce transmission in that sector.
Supervisor Lavanino made a motion. Is there, Supervisor Adam, I believe, seconded the motion? Is that correct?
I did.
I'm asking the maker of the motion and the seconder of the motion to accept that as an amendment.
You kind of broke up there, so I'm not really sure what, okay, where are we at? So we made a motion, we had a second. Supervisor Hartman asked if we could do individual motions, which I'm fine with. I mean, I don't want to put, we do that all the time. But I'm not understanding what Supervisor Williams, I'm trying to figure out what you're looking for. Is this in the
Why don't
first
we just
motion or
take
the
them
second
Let's
motion?
just take all the ideas separately. Let's have a motion to receive the report and
Okay.
make the CEQA.
Okay, so A and C.
Okay, motion's been made and it's been seconded. Madam Clerk, would you call the roll, please?
Mr. Williams?
Aye.
Ms. Hartman?
Aye.
Mr. Adam?
Aye.
Mr. Lavanino?
Aye.
Chair Hart?
Aye.
Motion passes
Okay, then I'll make a
unanimously.
motion that we provide staff direction to craft a letter to the governor asking for the purple tier to be amended so that churches and places of worship have the same provisions as retail, and that we ask Dr. Reynoso to continue outreach to the business community to encourage additional teleworking.
Again, I think we
Second.
should separate these
Telecommuting,
ideas.
telework.
So let's have a motion, as you described, regarding your direction to staff to write a letter. And then Supervisor Williams can do another motion on another thing.
Okay, we can do that. So that, we'll just do the letter then, for now.
Okay, the motion's
So
been
that's
made
my
and
motion.
seconded. Mr. Gazzoni, did you want to add something?
Not for this motion, but when we get to the next part, I'd like to discuss the relationship of the board and the health officer on directing or considering.
Is there any discussion to the motion? Supervisor Hartman?
Yes, I really appreciate in times of stress how important it is to have some kind of spiritual foundation. I do, however, believe that churches and retail are quite different. In churches, there's singing, there's chanting, there's communion, there's longer time. I wonder if it might not, however, be possible to encourage churches to stay open where people can go in and reflect, meditate, perhaps talk to the clergy members. I think that might be an alternative that would be comforting to people. I'm afraid I can't support the motion.
Supervisor Williams?
Well, I don't know anybody in the age of COVID that goes shopping for 15 minutes. I don't think that's physically possible considering the lines. So I think the difference in terms of risk with shorter church services and longer shopping endeavors is smaller than it ever has been. I don't quite buy that logic. And I don't necessarily, I have urged my church and I've urged other churches, even in an op-ed, to keep their services outside, that the things that you should have the right to do aren't necessarily a good idea to do. But I do not understand the how it is allowable to shop indoors, but not worship. I don't necessarily think that either should be permitted, but I just think that there should be consistency between those two.
The faith leaders that I talk to that have spoken directly to the community understand the moment and understand the challenge and want to protect their neighbors and friends and family, and have asked that their parishioners reconceive of how they can worship. And that is the safest way to protect people, and I think that has served us well, and I think this is a dangerous idea. Madam Clerk, would you please call the roll?
I'll just ask a question. I mean, would the maker of the motion agree to simply ask for greater consistency between spheres as a matter of language, and is that something that board members are more comfortable with? And I think that's maybe to the spirit of your motion.
I understand your point, Doss, but when you ask for consistency, then the easy thing for, he could just say, okay, then we're not going to allow retail either. So that's not what I'm pushing for. So I think we've all made our point. I think we all understand, each other's concerns. I'm going to let the motion stay the way it is.
Dr. De Reynosa, do you have something that you'd like to add?
I would be very uncomfortable crafting that letter. I can draft it for your board to sign, but I professionally, through many discussions with my colleagues as well as with our health officer, we do not believe that inside church services during a purple tier where there's widespread is the most prudent. So, and for the record, I do attend church. I do it outside. And I don't know if you recall, but we did reach out to many churches. I personally talked to at least 4 different churches, and they, like Supervisor Hart just mentioned, are quite uncomfortable with bringing their services inside as well. So for the record, I would be very uncomfortable drafting such a letter.
Mr. Gazzoni?
Chair and supervisors, I think there's a solution there. The motion was to direct staff, not to direct the public health officer. The CEO, under our county code, is our intergovernmental liaison.
Okay. Supervisor Williams?
Well, I'm really torn because I don't think that all of the things that should be allowed are prudent. I believe that in our frame of reference as a society, we've chosen in the past to give certain freedoms that I support to places of worship, and that generally in this society, those freedoms should exceed those of commercial activity. But I don't think people should be meeting inside.
Well, that's what this letter is going to ask the governor to do.
Again, I think there is that the issue that's for me is there are things that religious institutions should have the right to do that aren't necessarily something they should do, and that's really an issue.
Mr. Chair?
Yes, Supervisor Adam?
Yeah, if I might try to ply my colleague, Mr. Williams, a little bit. I agree with you that maybe not all things that are allowed or should be allowed are prudent, but that's for these churches to choose. And some churches allowed the freedom. Some churches will choose to meet and worship as they need to, and then other churches very well may not. And then their congregations can make a choice to follow that church's decision or to move. And so, I think that we need to allow people to make those choices, and especially with respect to practice of religion. I think this is so draconian and so unheard of. I can't believe it hasn't been litigated yet, but I think that we should at least for this, if not restaurants, if not hair salons, if not nail salons, churches. I mean, please.
That we have to date, we have avoided this sort of divisive approach and have remained respectful of each other's individual points of view and approaches to this pandemic. And I'm very concerned that this is a path that doesn't have an end, that remains respectful of each other's perspectives. This is the issue today, but there will be other issues tomorrow, and we will find ourselves very quickly split and divided and sending letters and posturing on public health matters during what could be the worst phase of this pandemic. And I would urge my colleagues to think very carefully about the implications of this decision today.
Mr. Chair,
Supervisor Lavanino.
I respect that, but we had a vote on a mask mandate also that we're fining people that some of us didn't feel was respectful of other people's beliefs either. So I don't really think this is all that controversial. I mean, let's be honest. Governor Newsom is not sitting on the edge of his chair waiting to hear what Supervisor Lavanino thinks about this.
Then why are you proposing this motion?
Because I think it's a symbolic measure of telling people that we respect their ability to go out and worship. And at 25% capacity, we're not saying go out and fill a church, a mega church, and put 1,000 people in there. I agree, that's wrong. But having a church service with 25% capacity does not seem like it's going to be the super spreader event that I drive, Costco's right here by the office, drive by there and the parking lot's packed. Everybody's in there cruising around, doing their thing, and I just can't see the difference between one or the other. Now, I think we have a motion, we have a second. I call for the question.
I just want to say something real quick. I do not think that churches should choose to do services indoors in the context of what's happening. I think we should stay outdoors for as long as possible. But Mr. Lavanino has expertly put me in a very binary spot. The bottom line is I do not want to live in a society where money and commercial activity matters more than our deepest held religious freedoms or lack of religious freedoms. And I just simply cannot condone a framework that gives more rights to commercial activity than it does to places of worship, and so I just have to support the motion.
Madam Clerk, would you please call the roll?
Chair Hart and members of the board, can I please get clarification on who was the second on that second motion on departmental item number 1?
I seconded.
Great, thank you, Supervisor Adam. Mr. Williams?
Aye.
Ms. Hartman?
No.
Mr. Adam?
Aye.
Mr. Lavanino?
Aye.
Chair Hart?
No.
Motion passes 3-2.
That concludes this item. We'll take a 10-minute break.